Penn State Health Hershey Medical Center celebrates the 40th anniversary of the first heart transplant. That's amazing. Talk to us about this.
My pleasure, and I've been around here for a long time. I went to medical school at Hershey Medical Center at Penn State, and when I was a second-year medical student, the first heart transplant was performed, and I took care of some of the earliest recipients of heart transplant as a medical student, and then came back later and took care of them after I'd trained in cardiology. And the way we've come along and the program has grown and developed and evolved is really phenomenal. So it means so much to me. We've touched so many lives over those 40 years to give them more life and better life. So it means things to me in terms of real people.
Let's talk about advancement. I know years ago I did a story about a gentleman who was waiting for a heart transplant. He had to push a machine along with him. So many advancements. Where are we at now with the program?
Well, in terms of supporting people with heart pumps, we've come an awful long way. We're one of the pioneers in developing those heart pumps. And in fact, since about 1976, we've been using some of those heart pumps. But the heart pumps now are smaller, they're electric, they're inside the chest. There's still an electric cord that goes from inside the body to outside the body, although we have developed ways at Hershey to get around that. Still not quite in the public domain yet, but in terms of heart transplant, all the drugs have really evolved and changed, and even the way we monitor for rejection. Historically, we'd have to do a procedure to get in the jugular vein, go down to the heart with a pincher device to sample the heart and look for rejection under the microscope. We still do that, but in many cases, we can do a blood test that looks at the gene expression in our immune cells or detects DNA coming out of that heart that the recipient has received from the donor and find the donor-derived DNA in the bloodstream. And when that goes up, it suggests something's going on with the heart. Then we do a biopsy only when the risk is higher. So we avoid a lot of uncomfortable procedures like heart biopsy. And our patients throughout the nation and internationally are doing better. They're living longer, they're living better, and we're doing better with the drugs and doing better monitoring the heart.
Oh yeah, absolutely. Now we are so fortunate to have Penn State College of Medicine right in our backyard. All this research is taking place. I'm sure the research only makes your program stronger.
Yeah, we have a great portfolio of research, both in heart failure to keep people going on with their own heart longer and living better, as well as research after heart transplant. We're involved in studies to better monitor for rejection and things of that sort. And when I was a medical student, we had no proven therapies to treat heart failure back then. Now we have many, and we can keep people living longer and better with their own hearts. But when we need it, we're doing even better with heart transplant.
Now your team has so many different locations. How does everyone work together to provide the best care for each patient?
Well, the majority of people, as I said, are treated with their own hearts. We don't have that many hearts to go around. Fortunately, most people don't need a heart transplant. We're able to manage them where they are. So making sure that we're all doing the right things and we have quality programs ongoing in all our centers in order to get the right therapy to people at the right time. And after that, if somebody does need advanced therapies, either a heart pump or a heart transplant, we have the ability to get them in quickly, get them evaluated, and get them their needed therapy in a timely fashion.
So much encouraging news. Dr. Boehmer, thank you so much for being with us.
Oh, you're welcome. It's a pleasure.